There are more signs of progress in the country's battle with the Omicron variant. The daily case count is down 86% since reaching a peak in most of the U.S. last month. The decline is also encouraging more cities and states to reduce or eliminate their coronavirus restrictions. Health officials say it's still critical to vaccinate and get booster shots. Michael George is here with the latest. Michael, good morning.
Jeff, good morning. No question, there's encouraging news. New cases are dropping, and they're dropping fast. Down 43% just this week compared to last week. But still, we're losing 2,000 lives a day to COVID. As states roll back restrictions, doctors are reminding us this pandemic isn't over yet.
In Indiana, schools will no longer require students who have been exposed to COVID-19 to quarantine, even in schools where masks aren't required. That leaves health officials there encouraging caution.
It's not as if we've cured COVID. We definitely have more tools now to fight it, but it's not a given that someone will have COVID and will survive.
Many remain at high risk, particularly the elderly, children too young to be vaccinated, and those who still refuse vaccinations. And if they get sick, there's another reality. Caregivers are in shorter and shorter supply. In Moorhead, Kentucky, nurse Courtney Hollingsworth, herself still on the front lines, estimates about 40% of the regional medical center's nursing staff left during the pandemic.
We're reminding ourselves why we went in to nursing, where we make a difference.
Nearly 3,600 U.S. healthcare workers have died of COVID. One study found that 41% of healthcare workers are considering leaving the profession for good. But not Dr. Aaron Parker Banks, the only doctor in a rural Kentucky family clinic outside Lexington.
The only thing that is semi-comparable and not even close is like a battlefield. And we've been fighting now for 2 years, but we're the only people left to fight.
And on Friday, New York's health commissioner announced the state won't enforce its booster shot requirement for healthcare workers. State officials admit that enforcing that rule could lead to staffing shortages at a time when doctors and nurses are already stretched to the limit. Michelle?
They certainly are. Michael, thank you.